Welcome all. Today we are going to see another disorder belongs to musculoskeletal system, rheumatoid arthritis. The word arthritis means inflammation and rheumatoid means any disorder which is affecting the joints, tendons, soft tissues and nerves but end with pain and deformity. If there is deformity, then we call it as rheumatism and rheumatoid. This is the word meaning. So when we consider rheumatoid arthritis, it usually affects the joint, but it is a chronic disease involving more than one joint. It is a chronic systemic polyarthritis, involving more than one joint. So we call it as polyarthritis. That primarily affects the small joint. It is the classical feature of rheumatoid arthritis because the initial manifestations are seen in the small joints of the hand and in the feet in a symmetrical pattern. What is symmetrical? Bilateral involvement of the joint. In case of osteoarthritis, initially one joint is affected and in a period of 3 to 6 months the other joint will also be affected, asymmetrical to symmetrical. Whereas in case of rheumatoid arthritis, the presentation will be seen in both the joint. And the disease has variable course. It is unpredictable. There will be lot of remission and relapse. Based upon the autoantibody level of the person, the disease severity also varies. And some people respond very well to drug treatment and few people are not respond. In any case, it is an irreversible disorder and end up with deformity. So early diagnosis and proper treatment is mandatory to keep the patient mobile. So we have to remember the terms that it is an inflammatory polyarthritis. Throughout the session, we will be comparing osteoarthritis and rheumatoid arthritis for a better understanding. In case of osteoarthritis, it is a degenerative condition due to aging process, whereas in rheumatoid arthritis, it is mainly occur due to autoimmunity. So it is an inflammatory polyarthritis and the pattern is very symmetrical. The hallmark features of rheumatoid arthritis are there is cartilage damage also, bone erosion and changes in the joint integrity. The joints tend to become deformed. There is deformity in rheumatoid arthritis. When we see the epidemiology and risk factors, the exact etiology of rheumatoid arthritis is unknown. It is a very common disease and we can see the patients throughout the year in our OPD. It is most commonly seen in monozygotic twins and in first degree relatives just because of the genetic predisposition. The commonest gene which is responsible for rheumatoid arthritis is HLA-DR-B1 and HLA-DR4. So HLA means human leukocyte antigen. The main trigger, the initiating factor for developing rheumatoid arthritis is triggering the leukocytes, directing autoantibodies against the leukocytes present in the synovial fluid. It is commonly seen in female and tobacco smoking, it triggers the autoimmunity. It also causes poor response to treatment. Tobacco smoking is not a causative factor in rheumatoid arthritis, but it is a triggering factor. So our typical patient will be a female of 30 to 35 years and usually they develop rheumatoid arthritis symptoms after first delivery and there will be a family history of rheumatoid arthritis either in the mother or in grandmother, usually in the first degree relatives. It is also seen in male in the ratio of 3:1, but they are elderly people. So the main pathology of rheumatoid arthritis is around the synovium, in the synovial membrane and in the synovial fluid. What is synovium? Synovium is nothing but a soft tissue. It is lining the non-cartilaginous surface within the joint with cavities. For example, we have a knee joint. Knee joint has femur and tibia. There is a cartilaginous substance which avoids the friction between femur and tibia. So the area femur and tibia coming in contact, it is called articular surface. In order to avoid the friction, there is a cartilage. So the synovium is something which is covering the lower end of the femur and upper end of the tibia. The synovium doesn't cover the cartilages. Apart from cartilages, around the joint, we have a soft tissue which is called synovium. There is a linear arrangement of cells in the synovium. And there is always some cavity or empty space in the synovium which secretes fluid called synovial fluid. This synovial fluid is capable of nourishing the joints. So the synovium is present in all the articular surfaces. Around all the joints we have synovium, and the outer covering of the joint is called joint capsule. So the synovium is a soft tissue. It is lying in between the lower end of the bones and joint capsule. So the entire pathology is targeted on the synovium. Synovitis is the pathology in rheumatoid arthritis. In case of osteoarthritis, the synovium is very intact. The main pathology is focal loss of cartilage, and because of loss of cartilage, the articular end of femur and tibia come in contact. They started eroding with each other, and patient will develop pain and stiffness. So in case of rheumatoid arthritis, the synovium is highly inflamed. It enlarges in size and it leads to pain and swelling of the joint. For better understanding of rheumatoid arthritis pathogenesis, we can discuss about inflammation. In case of any inflammation, there are few steps which is common in all kind of inflammation. Like there will be initial triggering process. It could be an entry of bacteria or virus which is called infection. So due to this infection, there will be accumulation of cells in the affected area. Commonly leukocytes, the WBCs will be accumulated in the affected area. RBCs also present there. So the affected area will be looking like a war field. There will be lot of accumulation of macrophages, lymphocytes and neutrophils. Based on the infection, we have either neutrophil accumulation or lymphocyte accumulation. For example, in cases of acute disease, we have neutrophils lining up in the front line. Whereas in case of chronic infection, we have lymphocytic accumulation. So like that, WBCs will be accumulated in the affected area. It also causes accumulation of fluid in the affected part, which leads to swelling or edema. And once the bacteria or virus is removed completely, the area will become normal. So it is called resolution. And there will be clearing of all the debris, apoptosis and necrosis will happen. So this is a common inflammatory process. We know the common signs of inflammation. There is pain and there is redness and swelling due to accumulation of fluid, and there is tenderness, release of prostaglandins causes tenderness, and there is warmth. So all these inflammatory processes are presenting in rheumatoid arthritis also. What we have to remember is the initial triggering mechanism. Commonly we see bacteria or virus as a triggering mechanism, whereas in rheumatoid arthritis it is autoantibody generation. Due to the genetic factor and risk factor, the synovial membrane, it is being infiltrated with lot of lymphocytes and plasma cells. This infiltration causes normal proteins into immunogenic proteins, autoantibodies. Autoimmunity is being activated in the synovial membrane. So rest all the processes are related with normal inflammatory process only. So the cell which is involving in inflammatory process is T and B lymphocytes here. The activation of T lymphocyte releases tissue necrotizing factor, interleukin 1 and 6. Because of these substances, the synovium started enlarging. It also activates the MMP. MMP means matrix metalloproteinases. These are responsible for destruction of the cartilages and chondrocytes. So it ends up with cartilage destruction and dislocation of the joint. So synovitis is the main pathology in rheumatoid arthritis, and the sequel of synovitis gives us the clear picture of why somebody is developing pain, why somebody is developing stiffness, and what is the reason for swelling in the joint, everything. So inflamed synovium, due to the inflammatory process, there will be large accumulation and large secretion of synovial fluid. The soft tissue of the synovium, it started proliferating, which leads to swelling of the synovium. So due to a chronic activity, chronic autoantibodies in the synovial fluid, the cartilage started damaging. Normally, in case of inflammatory process, it lasts for a few days or few weeks and then it will be clear on its own, because it is acute inflammation due to entry of bacteria or virus. Whereas in case of rheumatoid arthritis, the autoantibodies are constantly presenting in the synovial fluid. So the affected joint is like a war field. Throughout the year it remains as a war field. Whenever autoantibodies are increased, the inflammatory process will be triggered. That is the reason for flare-ups in rheumatoid arthritis. So due to chronic inflammation, the bones which are involved, the bones which are surrounded by the synovium, they started eroding. If it is a tendon, the tendon will rupture. In the initial part, there is no cartilage involvement because synovium is not covering the cartilages. But in the later period, there will be involvement of cartilages also, destruction of cartilage. At that time, there is reduction of joint space in rheumatoid arthritis. So it resembles osteoarthritis. But in osteoarthritis, we have new bone formation also, and it is a very slow process. It is a degenerative process in osteoarthritis. Whereas rheumatoid arthritis is autoantibodies related, it is autoimmune disease affecting the synovium of the joint. So under pathogenesis, we have to remember that rheumatoid arthritis is a synovial inflammation. There is synovitis. And there is interaction between T and B lymphocytes which trigger the process. Inflammatory process is triggered by them. The synovium started proliferating rather being destructed. So there is hyperplasia of the synovium and release of interleukin 1 and 6, and it is an inflammatory arthritis. So the word inflammatory arthritis helps us to write about the clinical features of this arthritis. Because we have cardinal signs of inflammation which is also present in rheumatoid arthritis. Clinical features. The typical case usually start with systemic symptom. The local and extra-articular features are later developed in rheumatoid arthritis. They usually have fatigue, anorexia, generalized weakness, and vague musculoskeletal symptoms. It appears until the synovitis develops properly. So sometimes it takes more than 9 months to 2 years to diagnose that it is a case of rheumatoid arthritis. Because the joint affections are lately developed, until complete synovitis occur, the joint symptoms will not be clear in a patient. So they will be taking treatment for vague symptoms for roughly 1 year or 2 years. And then there will be involvement of joints, usually small joints. And there will be symmetrical involvement. When we come to the local symptom, we have signs of inflammation. There is pain in the affected joint. Why this pain occurs? The pain originates from the joint capsule. When synovium started enlarging, it starts stretching the joint capsule. That leads to pain in the affected joint. And there is swelling of the joint. Because of soft tissue enlargement due to accumulation of synovial fluid and hypertrophy of synovium, all these leads to swelling in the joint. While stretching the joint capsule, there is stiffness will be present in rheumatoid arthritis, and stiffness is also present in osteoarthritis. In both the cases, the stiffness is felt after prolonged inactivity. But in case of osteoarthritis, it started relieving from 5 to 20 minutes, whereas in case of rheumatoid arthritis, the stiffness lasts more than 1 hour. And the stiffness is very severe in the morning times, morning stiffness. Only in cases of acute rheumatoid arthritis, we can see redness around the joint. It is not a common feature. When we come to the extra-articular manifestation, other than joint manifestation, rheumatoid nodule is a sign, and it helps to diagnose rheumatoid arthritis. And there is muscle atrophy. Atrophy means shrinkage of the muscles around the affected joint. And vasculitis. There will be microvascular injury in the rheumatoid arthritis patients due to the autoantibodies. And osteoporosis is very common in rheumatoid arthritis. Above the affected part and usually the lower end of the bone which is affected. Signs of rheumatoid arthritis. There will be swelling and tenderness in the affected joint, and it usually affects many joints at a time. There will be involvement of more than 3 joints, and the involvement will be bilateral. It is a symmetrical joint affection. And there will be pitting edema in the affected joint. There are some deformities which is classical to rheumatoid arthritis, and it helps to diagnose rheumatoid arthritis. One is buttonhole deformity. There is flexion of the proximal interphalangeal joint and leads to hyperextension of the distal interphalangeal joint. The reverse of it is called swan neck deformity. What we have to remember is in swan neck deformity, there is hyperextension of the proximal interphalangeal joint. And there is another deformity, it is called cock-up toe deformity. It occurs due to dorsal subluxation of the toes. And rheumatoid nodule is another sign. It is an extra-articular manifestation in rheumatoid arthritis. So these are nodules usually seen in the pressure areas of the body. The commonest areas are elbow and forearm. It looks like lipoma because these are painless and soft tissue swelling. The component of rheumatoid nodule is necrotic material, macrophages and cell debris. It is seen in people who have a high titer of RA factor. When the disease activity is more, then only patient develop extra-articular manifestations. Whenever there is some injury occurs, there will be discharge of blood and pus from the rheumatoid nodule. The diagnosis of rheumatoid arthritis is made up of many factors because there is no definite single factor for diagnosing rheumatoid arthritis. Even serum RA factor is also positive in many cases. So we need a group of symptoms and signs to diagnose rheumatoid arthritis. Usually the diagnosis is delayed due to non-specific systemic symptoms. As we have already seen, the systemic symptoms appear earlier in rheumatoid arthritis even before development of the local symptom, joint affections. So what we have to look for while diagnosing rheumatoid arthritis? There will be bilateral symmetric inflammatory polyarthritis, more than 3 or more joints are affected. And there will be involvement of both small joint and large joint, both in upper limb and lower limb. Presence of rheumatoid nodule and RA factor is another diagnostic criteria. Morning stiffness, more than 1 hour is diagnostic of RA, and increased levels of ESR, demonstration of joint deformities and erosion in X-ray, all these contributes diagnosis of rheumatoid arthritis. In blood investigations below are the common findings. ESR is usually elevated. It is between 40 to 80, and there will be reversal of albumin and globulin ratio due to chronic inflammation. And the anemia is normocytic and normochromic. Because in RA, anemia is due to osteoporosis and osteopenia. So the erythropoietic activity is being affected in RA. So there will not be any abnormalities in the RBCs, but only there is reduction in number of cells, normochromic and normocytic anemia. When it comes WBC, there will be normal count or will be leukocytosis. If there is presence of increased eosinophil, it indicates that the inflammatory process is very severe. AntiCCP is a specific test for rheumatoid arthritis. In cases where there is symptoms and signs are present and AntiCCP is positive, then we can diagnose that it is a case of rheumatoid arthritis. The normal value is less than 20 EU per ml. C. Reactive protein. The normal value is less than 10 mg per liter. Usually, an elevated CRP indicates that some inflammatory process is going on in the body. So it is a prognostic factor rather than diagnosing rheumatoid arthritis. During treatment, we can check CRP levels time to time to evaluate the severity of the inflammation and prognosis in a case of rheumatoid arthritis. Rheumatoid factor. The normal value is 0 to 20. Even though the name is rheumatoid factor, it is also seen in many conditions like SLE, sarcoidosis, interstitial pulmonary fibrosis, even in malaria and subacute bacterial endocarditis. With the presence of signs and symptoms and rheumatoid factor is also elevated, then we can diagnose rheumatoid arthritis. And it is also another prognostic factor like CRP. During treatment, we can time to time check the rheumatic factor to know the response about a medical treatment. Because high level of RA factor leads to development of extra-articular manifestation, and it also leads to deformity of the joint. Xray findings are very lately seen in rheumatoid arthritis, not in the initial stage. The commonest finding is joint erosion, and the adjacent joint may be showing osteoporotic activity, and there will be dislocation of the joint. The joint will lose its integrity in case of rheumatoid arthritis. When the cartilages are eroded, there will be joint space narrowing, as we seen in osteoarthritis. Management of RA. This area will be very useful to the homeopath. Because rheumatoid arthritis, it is an irreversible condition, it is an autoimmune condition affecting many joints. It is a chronic inflammatory polyarthritis. As long as there is inflammatory process, the disease will be keep on progressing to next level and it will end up with deformity. And these deformities affect the mobility of the patient. Even though we homeopaths prescribe on the basis of symptoms, it is very important to know the diagnosis and prognosis of any given clinical condition. Only this knowledge can help us to plan the goals of treatment. So in rheumatoid arthritis, it is a chronic inflammatory condition affecting many joints, leads to polyarthritis, and there are presence of autoantibodies. So the main aim is to arrest the inflammatory process. As long as there is inflammation around the joint, the pathology goes to next level. It leads to deformity and it affects the mobility of the patient. So the controlling the disease process is very important while treating rheumatoid arthritis. And the common treatment of rheumatoid arthritis is about taking corticosteroids. So we have to relieve side effects related to the steroid treatment also. Physiotherapy is the most important routine in a life of rheumatoid arthritis patient. Because the pain in joint usually originate from joint capsule. Whenever they stretch or extend the affected joint, they will feel pain. Because of that, the patient tend to keep the joint in flexed position. So when they keep it in the flexed position for a long time or long days and months, there will be bony ankylosis and soft tissue contracture which lead to deformities. So daily physiotherapy workouts will help to expand the joint capsule and it relieves the pain also and it keeps the patient mobile for a longer period. In pharmacological management, generally there are disease modifying anti-rheumatic drugs are given. These drugs are helpful in reducing the autoantibodies levels. And intra-articular injections are given for pain relief and to reduce the inflammatory process. Synovectomy is the surgical procedure. The main pathology is enlargement of synovium. There is accumulation of synovial fluid and there is hyperplasia of the synovium. Because of that, the joint capsule cannot expand and there will be pain while stretching the joint capsule. So synovectomy, removal of the excess synovium, it helps to increase the mobility of the joint and it also decreases the pain and inflammation. But it doesn't cure the rheumatoid arthritis, it gives relief to the patient. Homeopathy offers better relief in rheumatoid arthritis because our polycrests are capable of reducing autoantibodies and inflammatory process as well. Thereby we can improve the mobility of the joints and the quality of life of patients. Also it avoids deformities and extra-articular manifestations in rheumatoid arthritis. But early diagnosis and proper follow-ups are very important for a speedy recovery. In short, rheumatoid arthritis is a chronic autoimmune disease affecting various joints in a symmetrical pattern with marked small joints involvement. The main pathology is synovitis and joint erosion, and deformities are very common in rheumatoid arthritis. The diagnosis is based on signs and symptoms and also the presence of RA factor. Thank you.